Hello, my name is Patrick Brown, Mayor of the great city of Brampton, and welcome to our weekly COVID-19 update on the efforts the city has embarked upon in the Region Appeal to keep our residents safe. And I would note today I'm joined by Dr. Lawrence Lowe, our Medical Officer of Health, Paul Morrison, our Commissioner of Legislative Services, and the Director of Bylaw Enforcement, along with City Councillor Martin Medeiros, who is the Chair of our Reopening Task Force. Before we get to some of the updates this week, I just wanted to say on behalf of the city of Brampton a very happy birthday to the legendary Hazel McCallion. I understand there's a celebration today in Mississauga honoring her 100th birthday, which will officially be on Valentine's Day. But not only is she an icon of Mississauga, we've certainly benefited from her mentorship and guidance, and just a remarkable Canadian. So happy birthday, Hazel. I should also mention that normally we have a large New Year's levy in Brampton each year, and this year, because of COVID-19, it's going to be a virtual levy this weekend. And despite the fact it's virtual, it's still going to be a lot of fun. We got some contests for residents to participate in, and we got some special guests, one of them being famous Brampton resident Russell Peters, so it's always great to hear from him. So we got a great agenda coming up, brampton.ca/levy if you want to participate in our levy this Saturday. I want to thank the federal government for their announcement this morning on a commitment to public transit, $13 billion for transit projects across Canada. Brampton's got some ambitious transit aspirations. We've got a transit facility that we're trying to build right now. We're hoping to have the first electrified transit fleet in the country. And so we've got some really exciting transit projects in the works, and obviously federal funding is going to make those possible. And so it was encouraging to see the Prime Minister's announcement and commitment to Canadian municipalities for federal partnerships in public transit. I'd also like to comment today on the recent provincial announcement about the reopening framework. And of course, in Peel, we're not going to see the stay-at-home measures lifted until after February 22nd, but I certainly saw elements of the provincial announcement that I found encouraging. One of the big concerns we had in Peel Region was the lack of a level playing field between small businesses and big box stores. You go into big box stores and they continue to look like a zoo because of provincial exemptions for big box stores. With the reopening framework, it's going to be 25% capacity in those big box stores, 25% capacity in small businesses. So at least we're starting to see a level playing field, which is welcome. And I certainly believe Brampton will be ready on February 22nd for those initial changes that the province has announced. And of course, it's great to see that students will be going back to school. It's something that our medical officer of health had recommended, and I think it's important to have school in the classrooms learning. I would note that municipalities continue to lobby for a continuation of the Safe Start agreement. Municipal funding for additional costs due to COVID, whether that's public health cost, first responder cost, transit cost, that funding went until December 31st, and so we hope that the provincial and federal governments will come to the table just like they did in the past in terms of making sure there are no shortfalls for those critical frontline services. I should also note that the GTA mayors are working very much collaboratively, and so we have a meeting every Monday to make sure that as the reopening is happening, there's no confusion amongst the public, and so if there's a broad level of communication, it'll make sure that whether you're in Malton or Brampton or north of Etobicoke, there are some levels of common understanding of what is closed and what is open, and the rules that need to be abided by. So on that note, I'm going to ask Dr. Lowe to come and share his update, and then we're going to hear from City Councillor Martin Medeiros.
Thank you, Mr. Mayor, and good morning. This week, Brampton's test positivity is at 7.9%, which is down from 10.9% last week, with a weekly incidence rate of 155 new cases per 100,000, down from 195.7 per 100,000 last week. While trends are promising, our hospital situation is only just starting to turn the curve and remains tenuous. I take solace in the fact, however, that we have accomplished much together. Our provincial partners have deployed new testing sites throughout the region, including one in Brampton that is run by South Asian community partners that provides more culturally sensitive access to testing. With Council's leadership and community advocates, we continue to highlight data that supports paid sick days as an intervention to keep essential workers safe. I'm hopeful that our workers will eventually see this and other protections to help keep them safe. And finally, in the past week, we've provided 61 Bramptonians a safe place to self-isolate. Together with all of your sacrifices, our tremendous residents and businesses coming together, we are stopping spread, saving lives, and reducing the pandemic's impact on our healthcare system and community. This is a critical moment for our community in fighting COVID-19. Next week, students will return to in-person learning. Building on the success of the fall term, I know that the enhanced measures will support a safe reopening and keep schools open, hopefully, throughout the spring. However, I must be clear. Any further reopening that might be contemplated must be gradual to allow for appropriate assessment of trends and to prevent case counts, hospitalizations, and deaths from climbing again. We know, most concerningly, that the new variants detected in our midst could very well drive a third wave if we move too quickly. Rapid variant spread would erase the gains that we have made over the past 4 months, since in November, when our enhanced measures on social gatherings and workplaces initially bent the curve and held it there as we entered grey lockdown on November 23rd. The province has proposed that Peel could return to a revised reopening framework as early as February 22nd, and in entering that framework we could see the loosening of restrictions. That's coming 6 days after school reopening, which is far too early to fully assess the impacts that school reopening will have on our community transmission patterns. That, unfortunately, is not gradual. Our current daily average of new cases is at 280, which is where it was in November. After 2 weeks back then, we saw a 50% increase hitting 420 new daily cases. That was in 2 weeks. Now add in the variants and consider that we're exiting tighter restrictions. I think the risk is clear. I know we're all tired and we might be seduced by the idea of reopening. However, moving too quickly beyond a return to school could present the difference between a third wave or exiting the pandemic successfully in short order. Just a few more weeks of staying at home could very well save us months more of agony, keeping the variants down as vaccine coverage and the weather improves. We've already come this far, and it's imperative that we hold on to avoid another shutdown. We don't ever want to use the emergency brake that has been proposed in the new provincial framework. So for the next few weeks, as schools reopen, we need to continue to stay home as best we can. Even if this weekend we'll see the Lunar New Year, Valentine's Day, and Family Day, even as the weather starts to get better towards the beginning of March, we need to stay safe and to stay apart so that we can end this with confidence. Thank you, and I'll pass it back to Mayor Brown.
And next up, we're going to have Councillor Martin Medeiros, who's going to share an update. And thank you, Councillor Medeiros, for your hard work as the chair of our reopening task force.
Thank you, Mayor Brown. I am Martin Medeiros, Regional Councillor for Wards 3 and 4 and the lead of the Reopening and Recovering Working Group. As the city continues its response, one of our key areas of focus is our local business. Our businesses continue to be severely impacted by the closures, especially here in Peel, where the province's stay-at-home order will remain in place till February 22nd. At the time, if the stay-at-home orders ends, the province has shared the positive news that limited in-person shopping in grey lockdown zones will be permitted with public health and safety measures. This includes limiting the capacity to 25% in most retail settings. I want to acknowledge our business owners in their ongoing hard work to make a living and provide for their families. We're here to support you now and look forward to eventual reopening. This morning, I would like to note that Brampton residents must continue to stay vigilant in the current lockdown, especially as we head into the Family Day weekend. This year, Family Day takes place on Monday, February 15th, and the City of Brampton has a number of activities for you and your loved ones. The City has virtual games and activities for the entire family and free crafts kits available for curbside pickup. To sign up, residents can visit brampton.ca recreation. We also continue to offer our outdoor recreational activities for the family at low risk and great way to keep active. City rinks will be open on Family Day by reservation, weather permitting. Reservations are available up to 24 hours in advance, and for details and bookings, visit brampton.outdoorskating or call 311. Please remember, non-medical masks or face coverings are mandatory on the ice at all outdoor rinks where participants are over the age of 10. I would like to wish you a happy Family Day and have fun and stay safe. Thank you.
Thank you, Councillor Medeiros, and the work of the reopening task force. For a bylaw update, I have the information from Paul Morrison, our Director of Bylaw Enforcement. Over the period of February 1st to February 7th, there was a total of 23 charges, 10 charges for the mandatory face covering bylaw, 9 charges for the reopening of Ontario Act, 4 charges for the Emergency Management and Civil Protection Act. So once again, a wide level of compliance. That's in a city of 700,000. That's not a significant amount of charges. I know I got a few questions if there was any Super Bowl parties. There was only one incident, a small party where a charge was laid, but overall we saw a wide compliance on that day that I know we were a little bit nervous about. In terms of an Osler update, I've got an update also from Dr. Naveed Mohammed and his team at William Osler. They have continued to have an aggressive level of testing, 355,923 COVID-19 tests across their sites. In terms of Osler's capacity, there are 32 COVID-19 inpatients at Brampton Civic Hospital, 6 of which are at ICU and 22 which are suspect patients of COVID-19. So the numbers do continue to decline, but as always, healthcare capacity is always stretched at Osler, and so we're grateful for the ongoing work that our healthcare workers are taking on the front lines of this battle with COVID-19. So on that note, I'm happy to take some questions about this week's update, and I see first on our list is Irene from 680 News.
My question is, so February 22nd could be the reopening for Peel, but the 16th for places like Halton and Simcoe, and it's so close to Brampton. I'm wondering if there is any worry that residents will leave the area to get a bit of a kickstart on their shopping.
You know, I do worry. I believe that the greater GTA, there's a lot of commonality, and I think we've seen previously, if you look at cell phone data and traffic data, was that when one region was open, the other wasn't. There was a lot of people hopping over, and so I do believe that the sooner we have consistency across the GTA and surrounding areas, the better it'll be able to actually enforce the goals of public health.
And this is more to do about schools, the province looking at possibly canceling or moving March break. I'm just wondering where everyone stands on that.
Okay, I'll have Dr. Lowe share his perspective. I certainly support Dr. Lowe's advice when it comes to when students should be in school.
Yeah, thank you, Irene, and thank you, Mayor Brown. Certainly the decision around March break is one that we anticipate will be taken by our Ministry of Education and school board partners. From our perspective in public health, we do recognize that children have been out of school for some time, in classroom that is, and that there are benefits for their learning and their socialization in being able to recoup that time in school. We also know that people tend to gather around holidays. That's been seen throughout the pandemic. But ultimately, from our perspective in public health, our goal is really to focus on the reopening at this point in time, and the decision around March break we will ultimately leave to our school board and education partners. Thank you.
Thank you, Dr. Lowe. Our next question is Graham Frist from the Brampton Guardian.
Good morning, guys. First question is for Dr. Lowe. I'm just curious about transmission rates at long-term care homes. Since the vaccines have been deployed, are we seeing a big effect on that? Is there still a significant spread in long-term care homes? What's the situation in that regard?
Thanks, Graham, for the question. Certainly, we are seeing more and more homes start to exit outbreak, whether that's a direct result of the vaccine or really a reflection of our community transmission rates starting to come down needs to be teased out. We will have further clarity on that question once we've been able to deploy our second doses amongst all of our long-term care home residents and continue to monitor the impact that program is having. But really, it does speak to the very tenuous situation that we're in. We're glad to be seeing cases coming down in our community, and we must continue to move carefully to protect those vulnerable populations, especially as we vaccinate them. Thanks for the question.
And Graham, is there a follow-up question?
Brown. What are the priorities for Brampton, I guess, in the upcoming provincial budget? Some of the things that council is focusing on.
I think I'd say right off the bat it would be new hospital, new hospital, new hospital. For my top three priorities, it's healthcare. The provincial average for hospital beds is 2.19 for every 1,000 residents. In Brampton, we only have 0.9 hospital beds. We have half that is the provincial average. And as I've spoken to the Premier and the Health Minister about many times, as our council has, we need to have equal healthcare access in this province. And it's embarrassing that there are some segments of our country that simply don't have the same access to health care. It's one of the reasons we've really felt pressed during this pandemic is we don't have the same healthcare capacity. So that's going to continue to be my top priority in my advocacy to the province, and we're hopeful that they're going to come through. Our next question is Wakas from the Urdu Times.
Good morning. My question is to Mayor Brown.
Yes.
Mayor Brown, the U.S. Election Act has exposed the problem with activist media that pushes a political agenda rather than the report facts. Canada isn't immune to that problem with groups like Rebel Media and the Pointer or the Birthmark that push extreme agendas. What do you make of extremism in Canada and the recent decision to list the Proud Boys as terrorist group?
So I certainly support the listing of the Proud Boys as a terrorist organization. I'm glad that the federal government has taken a strong stand against hate, and we can't be naive to think what's happened in the States that we're immune from in Canada. We can't have an environment that gives voice to hate, and unfortunately, sometimes there are organizations that, whether it's online blogs, that give momentum to that type of vernacular, and I do hope that in Canada we continue to push back against it. And so congratulations to the federal government for taking a leadership position. I know I've spoken to members of our council. We certainly support that direction and that strong leadership. Thank you. The next question is Steve from in Brampton.
You mentioned earlier about the enhanced measures that will be in place for the students and teachers return to school. But in a letter sent to you by the Peel Public High School teachers this week, they said they don't really see what the enhanced measures are. They don't see any difference from what's been happening before. Can you explain what those enhanced measures will be and what the difference is?
Okay, I'll have Dr. Lowe speak to that because it's his advice that is being given in terms of what measures are necessary.
Yes, thanks, Steve, for the question. Certainly, Peel Public Health will continue with single symptom screening, which is different from the point in the province where they still use the dual symptom screening approach. This will provide an additional level of protection in ensuring that individuals who are not symptomatic are presenting at our schools. We also have additional recommendations in respect of isolation of family members and close contacts who may be unwell or who may have been exposed to COVID-19, and that information is going to be released shortly. And as mentioned, as given by our provincial and Ministry of Education partners, there is going to be expansion of rapid testing and more availability of testing overall to ensure that responses in outbreaks can be quick and rapid. And I understand that we're just putting the finishing touches with Ontario Health around mobile testing, which will also be announced hopefully in this afternoon at my press conference in Mississauga. So I think with Mayor Crombie in Mississauga. So there are a number of measures that have been taken. It's important to remember that we are now also at a level of community transmission that is reflective of where we were in the late fall, and we did manage to make it through the entire fall term with limiting transmission in school settings. So the data and evidence is very clear that with the measures that were there in the fall, that we are now building on with this reopening in the winter, that schools will continue to remain a fairly safe venue for educators and students, in terms of through the measures that have been taken. Thanks for the question.
And the follow-up would be the teachers are also asking for the vaccine before the return to the classroom. Is that a possibility that they'll be receiving them?
At this time, vaccine supplies are extremely limited. The provincial prioritization is targeting those who are at the greatest risk of dying and severe disease. That includes long-term care home residents and certainly as seniors starting with over the age of 80. We understand are the next priority groups. Teachers, like many other essential workers, myself, healthcare workers, etc. We do recognize the risk, but we also recognize that those that are most severely at risk of severe outcomes and death are our elderly, particularly those in congregate settings, and they are being prioritized for the vaccine at this time. Thank you.
Thank you, Dr. Lone. If I could just add to that, of course, we would love for everyone to be vaccinated, but Canada doesn't have the supply right now. And if anything, it's just another reminder of the desperate need there is for Ottawa to have procurement of these vaccine contracts that arrives now. I'm tired of waiting. I wish all our teachers could have vaccines. And we're still at a point where only half of our healthcare workers that work at Osler Health have been vaccinated. So obviously, there is a priority right now for those that are most at risk, and the province and Peel Region have to follow that prioritization. But boy, if you look at the vaccination rollout in the U.S. and the U.K., or the UAE or Israel, I would love to see that type of supply be available in Canada so that we could vaccinate everyone. It's not a question of whether we like to; it's what supply exists in Canada. So I just thought that's important to underline. Our next question is Nitin Chopra from Prime Asia TV.
Good morning, Mayor Brown. My first question is to Paul Morrison. Paul, do you have a strategy or any challenges you have for the province reopening plan on 22nd? Do you have enough bylaw officer to implement that effectively?
Good question. Thank you, Nitin. You know what? We have found over the last 6 to 8 weeks that the City of Brampton has really come around and supported our request to stay at home, not social, to continue to social distance, not breach any of the regulations. So our staffing model is geared towards continuing along that line, and we don't see a big uptick. The one thing we have done is we've changed from more education to a little more enforcement. We feel the rules have been in place long enough that people know, so we are giving less warnings and we're giving more tickets out, but not in any great numbers. So we're going to continue to do that. We're going to see how the community responds, and hopefully on the 22nd of February, when the conditions are changed again and we have to adapt to those, that everybody will follow the rules.
I have a follow-up for Mayor Brown. Mayor Brown, on the question of funding for university in Brampton, either Brampton U or Ryerson University, when we reached City and we interviewed you, you said the file and project is submitted with the province. I'll read the province reply to you, and if you can clarify, please. Their reply is the Ministry of Colleges and Universities had not received any proposal from City of Brampton or other parties for establishing university in Brampton, but looks forward to receipt and review it for the students' careers and address the labour market gap in Ontario. So they are ready to do that. Can you clarify on this? Where is the file?
Yes, a submission has been made to the province, and right now we are actively talking to the province about what the next step would be in terms of the vehicle which would continue to move the project down the right path. I would say I don't want to preempt any provincial announcements, but we've had very positive discussions with the province on this front of additional post-secondary possibilities in Brampton. Okay, our next question is Logan from the Uthien News.
Yeah, good morning, Your Worship. This is Logan. Even though I do live in Scarborough, my newspaper serves the Tamil community in your city. Minister, Mayor, my question is, you said you are waiting for vaccines from the federal government. So far, so tell me how the distribution within your city worked or works.
Well, thank you, Logan, for the question, and we're proud to have a large Tamil diaspora in our community, and we have an update for them actually that I'll have Councillor Martin Medeiros share after I answer your question, and that is that in terms of the vaccine supply, it's provided from the federal government to the provinces, and the province will then provide it based on their prioritization list. Right now, the focus of vaccines has only been on long-term care workers and hospital workers because Canada doesn't have the supply right now for seniors, other frontline workers, and we do hope that the government is able to procure additional supply. We desperately need it, and as one of the hardest hit areas in the country, our frontline workers, our seniors, our vulnerable populations, we desperately need that vaccine. And I can tell you, as soon as that supply arrives, we'll be ready, whether it's a mass vaccination center. Dr. Lowe has already put extensive work into creating the ability to have mass vaccinations once that supply arrives. We'll be ready in Brampton. We'll be ready in Peel Region as soon as Canada gets those vaccines. And Logan, in terms of the Tamil community, one thing that we just announced last week, and it was the initiative of Councillor Medeiros, is we saw the monument destroyed monument remembering the victims of the Muluvakal massacre, the Tamil genocide, and we were so aghast in Brampton that we passed a motion to rebuild that monument in Brampton, because to have a cultural genocide on the footsteps of a physical genocide is abhorrent. And in Brampton, we stand shoulder to shoulder with the Tamil community. You cannot rewrite history, and that was blood-stained history that Canada has spoken out against. We boycotted the Commonwealth in Sri Lanka. We've spoken about this at the UN, and the notion that this chapter in world history could try to be erased is offensive. And I want to thank Councillor Medeiros for his leadership role in putting forward that motion, and he could share a few details about that.
Your Worship, because I don't want to, because I'm very happy as a member of the community. And before that, I would like to thank.
Yeah, and thank you. And just to follow up on what Mayor Brown, the interest and the overwhelming support and interest has been truly remarkable. We've had contacts, and I know all members of council and Mayor Brown, we've had congratulations from as far as the UK, all over Europe, back home in Sri Lanka, and certainly the diaspora. And my understanding that other municipalities across the province now, where there's a large Tamil diaspora, there seems to be a movement to do these type of activities. So again, this is unanimous for council, and all council members with the leadership of Mayor Brown, we really stuck together and took a stance for the Tamil diaspora, especially here in the city of Brampton.
Thank you to the city and Your Worship and other councillors, because Brampton is the one and only council sends the translation in Tamil to our office. I don't think even the bigger councils in the province. But so I have to thank the Gurvinder and the Monica and the two the officers they work for you. So they are doing a good job, and I'm very easy to spread the stories. We get in Tamil. Thank you.
Well, thank you, Logan. And I would just say and this wraps up our questions for today, our question time, but I just wanted to say to Logan and the Uthien News that one of the reasons that we communicate in the top 10 spoken languages in Brampton is to make sure that our messages get through. We've heard that when there's important messages to be carried by government, that sometimes there are linguistic barriers. And so in Brampton, we do communicate fully translated in the top 10 spoken languages. And so if there's a public health message that needs to get out, we believe by communicating multiple languages that message can get out. And if you look at how critical it is to make sure everyone understands, the requirements that exist, whether it's wearing a mask or physical distancing or what's closed or what's open, getting these messages out to every corner of the community, to every linguistic group is critical. And I want to thank all our partners who enable that to happen. On that note, we'll have another press conference next Wednesday. And to everyone watching at home, please stay safe, stay healthy, and thank you for tuning in today.